Today I will be sharing 5 nursing tips that I feel will help you along your journey in nursing school. It's something that I'm sure you have learned, but it isn't applied until you're on the floor working as an RN. My name is Christina, nurse practitioner. Let's get started. Nursing tip number 1, your patient has severe nausea. However, they have a prolonged QT interval. Normal QT ranges from 0.4 to 0.44 seconds. Anything greater than that can potentially throw your patient into a ventricular rhythm that could potentially be lethal. So the most common go-to meds are Zofran, Reglan, as they work great with reducing symptoms. That also includes promethazine. However, these antiemetics prolong your patient's QT interval, which is what you want to avoid. So a safe alternative medication, drum roll please. Try methylbenzamide. It works great. Nursing tip number 2, you just got assignment for your patient and he is going through a VTach storm. A VTach storm is when your patient is having multiple episodes of ventricular tachycardia. So before handoff, you want to make sure you know your potassium and your magnesium goals and know what the patient's current potassium and magnesium levels are and what has been repleted. Typically for this patient, they will be in a CCU setting, critical care unit, and they will want their potassium greater than 4.5 and magnesium greater than 2.2, which is always on the higher threshold. Nursing tip number 3, if your patient is on diuretics such as Lasix or hydrochlorothiazide, formerly known as HCTZ, you'll want to monitor their electrolytes because when on a diuretic, your potassium and your magnesium can be depleted. So it's crucial to check during your 12-hour shifts, sometimes twice a shift, and address with the team. Or if there is a change and you're noticing patient is starting to have some ectopy on the monitor, such as PVCs, which is premature ventricular contractions, that should prompt you to want to recheck electrolyte level and also page and document your findings with the team. Nursing tip number 4, if your patient has a scheduled PET scan, so this test can help detect early signs of cancer and heart disease. The test requires your patient to be NPO, which is nothing by mouth, and the scan can take anywhere from 2 to 3 hours. Upon transfer, the technician conducting the test is going to ask you the patient's last intake and when was the last dextrose of IV given, as it should be greater than 16 hours, as the patient cannot have any IV dextrose containing medications prior to test. So it's important to ask the receiving nurse giving you handoff when was the last dose of IV dextrose, or if you receive a new order for a PET scan, be sure to notify the pharmacy and have them switch any of the IVs that contain dextrose that can commonly be found in antibiotics to normal saline in lieu of the test. The reason why dextrose is not permitted for a PET scan is because it affects the quality of the results of the test. So good to know info. Moving on to nursing tip number 5. For your patient that just had a bronchoscopy test, during the recovery phase when handoff report is given to you by anesthesia, you want to ask the provider if they can order you a PRN breathing treatment, if it hasn't already been ordered, to decrease any type of bronchospasm, which is an irritation in the airways. So 99% of the time your patient comes out coughing and they feel so uncomfortable. So it's nice to have that order available to save you time, and if it's needed, you just notify the RT. So this will also be the patient that also needs a chest x-ray to rule out a pneumothorax. Well, that's it for me. I have a lot more to share, but I just wanted to highlight a handful for you to carry in your pocket with more to come. Thank you so much for watching. Be sure to subscribe for upcoming notifications. Take care.